Welcome to Fraser Fast Track, the Fraser Institute's look at the week's key news stories. I'm Leah Costello. This week, we're joined by Don Boudreau, Chairman of the Economics Department at George Mason University, discussing President Barack Obama's plans to overhaul the U.S. financial regulatory system. Jerry Angevine is a senior economist with the Fraser Institute, and he'll be giving us the inside scoop on his 2009 Global Petroleum Survey. And finally, John R. Graham. John is a Canadian policy expert living in the United States and working as the Director of Healthcare Studies at the Pacific Research Institute. He'll be telling us what he thinks is wrong with the U.S. plans to reform healthcare. Starting with Don, President Obama has outlined a proposal to increase regulation in the U.S. financial markets through the creation of an oversight council and other measures. Are these greater regulations an effective way of preventing another financial crisis?
Greater government regulation is not an effective way to prevent another financial crisis. A lot of government regulation is responsible for the current financial crisis that we're now suffering. More regulation will only make problems worse. Keep in mind that government is the one institution that is systematically involved in the economy, from control of the money supply to national regulations from the Atlantic to the Pacific. A lot of these things look good on paper, and they may even have good short-term effects and consequences. But when they play themselves out, as they are doing now, we see that the consequences are bad. And so a lot of the politically motivated regulations that we had up until last year, well, we still have them, but that led to the crisis that started last year, a lot of these regulations, we're stuck with them. People can't opt out of them.
So what are the possible consequences to the economy and the U.S. financial markets if these proposals go through?
Well, one of the goals, ostensibly, of these regulations is to reduce systemic risk throughout the economy. One of the actual consequences will be to increase systemic risk throughout the economy. Once again, the government is the big player in the economy. If it gets it wrong, the entire economy suffers.
So then what would you like to see the U.S. government doing instead?
Well, the first thing it should do is to recognize that we got ourselves into a bad fix. We had a lot of bad investments, a lot of bad choices made over the past several years. These things have to be cleaned out. After that, avoid these same bad policies, which means knock down barriers to investment and consumer choice. Reduce capital gain. I'd like to eliminate capital gains taxes. Reduce tariffs. Keep regulation sensible and to a minimum. You do this, you decentralize the economy, you let entrepreneurs actively compete for consumer dollars. People aren't stupid. They're not going to rush out and invest in dumb things, not in general. And so when that happens, the decentralized market economy will come back into play, and some people who make mistakes over here, those mistakes will be offset by people who make good choices over here. You won't get this entire economy-wide systemic contagion that was imposed upon the economy by really misguided national government policies that came down from Washington, handed down by people who really don't know anything about the way the economy works, and again, who are really ultimately politically motivated and not economically sophisticated.
Thank you, Don. And speaking of creating a strong climate for investment, Jerry, you've just released your 2009 survey of petroleum industry executives and managers. It ranks Alberta as one of the least attractive Canadian provinces for upstream oil and gas investment. What's caused this dramatic decline over the last couple of years?
There have been a number of things, Leah. One of them, the most important, has to do with the so-called new royalty framework that the government announced in the fall of 2007, but it went into effect this year, January 1st of 2009, and it really puts upstream investors involved in Alberta at a disadvantage relative to the neighboring provinces, and also Manitoba. And another one is the high degree of regulatory uncertainty because of the government's changes in royalties and then attempts to partially fix the problem as perceived by investors. So the government's really getting feedback that it's a difficult place for investors because of the regulatory uncertainties, the cost of regulatory compliance, the fiscal regime, and another factor, the Aboriginal land claims, the demands by Aboriginals are in some cases holding projects up.
And so how are these policies impacting investment in Alberta?
Well, really, they're having a bit of a difficult impact. The major companies, certainly, and smaller companies as well, are allocating their funds for upstream investment a little differently. They're allocating more to Manitoba, Saskatchewan, and BC, larger proportions than in the past in many cases, and also looking elsewhere in other countries.
So the government has responded to your study by making some changes to the royalty regime. But what else does Alberta need to do to improve their investment climate?
I think the Alberta government needs to listen to the industry, to sit down with them and to really understand the industry better and the bottom line, and be more amenable to positive changes that would lead to more investment.
Thanks, Jerry. And now to John for our final topic. The U.S. is looking to control costs and widen insurance coverage in their healthcare system. One of the proposals on the table is to create a so-called public option to complement their private system. What does the U.S. administration mean by a public option, and how is this different from a Canadian-style single-payer government healthcare system?
Well, thank you for asking the question, Leah. I mean, if you listen to President Obama and Secretary Sebelius and the Democrat leaders in Congress, it's not a Canadian-style single-payer healthcare system. But it's hard to believe it's not a Trojan horse to get a Canadian-style government monopoly.
And so will this achieve their goal of controlling costs?
The bill that came out of the Senate Health, Employment, Labor, and Pensions Committee, which is Senator Kennedy's committee, had about 40 new government bureaucracies, any of which I suppose you could call the public option. The cost was in the, when the Congressional Budget Office costed it out, what the cost of the so-called public option would be, it really blew the doors out, so they went back to the drawing room, and just this morning they claimed to have got a new cost estimate that would cost down to $600 billion. I haven't had time to look at that estimate yet, but I doubt that passes the laugh test. There's simply no way you could enroll millions of people in a public option at that low a cost.
And what then are some of the reforms that you do think the U.S. government should be considering instead?
Well, they should carry on the track that was started by President Bush, who didn't do a lot of great things in healthcare, but he did one very good thing. He implemented something called the Health Savings Account, and now we've got somewhere between 7 and 8 million Americans have a health savings account, which is just a mechanism to give patients pre-tax dollars that they can spend on health care of their choice. Not chosen by an insurance company, not chosen by the government, not chosen by a manager in their HR department of their employer. We're seeing premiums are dropping. There actually, some plans are having negative premium growth and negative cost growth, because when the doctor says to the patient, you need an MRI, you need a CT scan, you need this test, you need this prescription, the patient is saying, well, that's going to cost me how much? And it immediately changes the dynamic of the doctor-patient relationship. The doctor's working for the patient, he's not working for the government, he's not working for the patient's employer, and he's not working for an insurance company. That's the right incentive, and I would hope that President Obama would learn from that experience and keep moving in that direction.
Thanks, John. And thank you so much for joining us this week. Make sure that you get our episodes as soon as they're posted. Make sure that you've subscribed to the Fraser Institute channel on YouTube or to the RSS feed at fraserinstitute.org/multimedia. We'll see you next week for Fraser Fast Track.